All right. Well, thank you everybody for your patience. You know, technology is always a gift in that we can talk to each other from across the nation right now, but it's always a struggle as well. So thank you all so much for your patience. We are gathered here today for the webinar on breathwork sessions with Analisa Rockbridge. We're very excited to have her here again. She's done several webinars already with AICAF. She's probably a semi-pro at it by now, but she's going to be giving us some new information today, which we're all very excited about. Just a little bit of more information. My name is Ashley Polans. I'm a Senior Program Specialist at the American Indian Cancer Foundation, and we're very happy that you joined us for Sacred Breath Day and for the entire month of November as Sacred Breath Awareness Month. We posted a few questions already in the chat feature just to get you all started. You all are on mute right now, but we still encourage you to still engage and interact with us through the chat feature. So get comfortable with that right now. And then another piece to note is that this webinar is being recorded. And so if you missed some of the information, or if you thought this information was so great, you want to send it to your friends and family, you can do so after we have posted it on the AICAF YouTube channel. And without further ado, I'm going to introduce us to our guest speaker today, Analisa Rockbridge. She's the creator of Mother of Sage Yoga. Rockbridge received her teacher training from Yoga Works 500 in Los Angeles, California. Her son Sage was only 3 months old when he was diagnosed with acute lymphoblastic leukemia. Through the healing journey with her son, Sage became a survivor through CAR T-cell therapy, and Rockbridge learned to breathe. Now through Mother of Sage Yoga, Rockbridge shares what she has learned, which is breath awareness, passive movement, and mindfulness to improve quality of life. So thank you so much, Analisa, for joining us today.
Thank you for having me. I appreciate you guys allowing me to have the time to speak today about how to link breath awareness and just exercising our lungs through exercise of yoga, as well as breathing techniques. So today I want to talk a little bit about how we can make a sacred space in our area. So behind me, as you can tell, I have my yoga space, and it has a lot of plants. The reason I have a lot of plants in our main living area is because that's where my son and I, or my family and I, will gather together, and I want to make sure that that area is the cleanest area for us to sit in. So we don't have any carpets, as you can see, and we don't have any rugs as well. This helps keep all the dander and dust down. The blinds as well, I don't have any window coverings or any kind of dressings or blinds on those, or curtains, because I would have to have those laundered every time that I clean the blinds. And the preference for clean air quality in this house is going to be thicker blinds, because I can clean each individual one versus the smaller blinds, which are a little bit more difficult for me to handle on a monthly basis. We do clean the blinds and the baseboards monthly. Sage, since he was a cancer survivor, he does have asthma, so I just try to keep the dander and any type of dust quality low in our house. We do have a couple of HEPA filters throughout the house, but we do try to keep things and the air quality by keeping the plants in the house. And we also don't allow the little air freshener plugins. Just be aware that sometimes some of those plugins, I believe the ones from Bed Bath & Beyond, the wallflowers, those ones actually release carcinogens into the air. So we do want to be aware of what kind of aerosols we're spraying in the air for refreshing, or if we're plugging in any kind of wall incense, so that we are making sure that anything that we're breathing into the air is going to still be okay and healthy for our lungs. I do also want to speak about how exercising the lungs, when you exercise and you begin to breathe heavily, it starts to expand your lungs, and it starts to increase the rate of oxygen that your body receives. And when the amount of oxygen that increases inside of your body, it starts to strengthen the lungs and the hearts. So when you do one yoga practice, it should be equivalent to taking a nice brisk walk outside. So Both are passive movements, but both still allow oxygen to circulate throughout your body to increase the lung capacity. Lung capacity can be increased between 5 to 15% when you do a daily exercise, such as walking or a yoga practice. In the yoga practices that I teach on Mother of Sage Yoga, I do also offer breath awareness. And today I want to talk to you as well about the breath awareness techniques that we'll be doing. The first one we're going to be doing today is called Ujjayi Breathing. And that's where it's a normal breath. So you would breathe in normally through both of your nostrils. And then when you exhale, it would be the type of exhale as if you had a mirror in front of your mouth and you were trying to fog up that mirror by, but instead of opening your mouth to actually release the air, you're going to keep your mouth closed, your lips closed, and release the air still through the throat, but making a sound of a saw. So when you inhale, you should be able to hear an audible inhale. And then when you exhale, you should be able to hear the exhale, not exaggerated, but you should be able to hear the exhale against the back of your throat, almost like a glottal stop. So when you inhale, inhaling through both the nostrils, and then exhaling through the pressed lips. So just as if I was exhaling the breath, I'm doing the same exhale with my lips closed. And what that is doing is going to continue to circulate all of the fresh air throughout my nostrils and throughout my lungs. It will continue to cleanse my lungs of any phlegm in the morning if I were to have any type of congestion buildup throughout the night, post-nasal drip for any type of perennial allergies throughout the night. So a 5-minute breathing technique of Ujjayi breathing can help clear out the lungs and reset your nervous system and calm your nerves. When your body, pardon me, when your body starts to calm down, your nervous system starts to calm, and you're able to start taking breaths deeper and calmly and evenly. And so what we want to always do is have our exhales extend further than our inhales. So when we inhale for maybe 2 or 3 counts, we want to exhale for 3 to 4 counts. So we want to just make sure that we're doing this in a sighing motion as well. So it would be equivalent to a sigh. So let's begin the technique. Let's begin by taking 3 cleansing breaths together. And we'll do this by just inhaling gently through our nose. And then open mouth, sigh, exhale, just release the air. And let's do that again. Let's inhale. And let's hold at the top this time. And then open mouth, sigh, exhale, let it go. Beautiful. So let's do that again. Inhale through both of your nostrils. Hold at the top. And try sipping in just a little bit more air. Now open mouth, sigh, exhale, let it go. Okay, so let's begin our Ujjayi breathing. Let's inhale through our nose. And then keep the lips pressed and begin to exhale the air through our nose, keeping the lips pressed. Again, inhale through both of your nostrils and exhale. Again, you should be able to hear each inhale through both of your nostrils for 1 breath, 2 breaths, hold, and then exhale the air by keeping your lips closed. And let's do that again. Let's inhale for 1, 2, 3, and pause. And then exhale, keeping the lips closed. Again, inhale for 1, 2, 3, and pause. And begin to slowly exhale. Beautiful. So right now you should be able to notice how maybe your shoulders are beginning to drop and just how your nervous system is beginning to relax and you're starting to just become a little bit more comfortable with the breathing. So now we have relaxed a little bit more. I do want to introduce another breath, and this will be accessible to patients or to anybody who isn't very mobile. Maybe sometimes it's hard for us to get out of the breath or out of the bed in the morning time. And exercises can cause us to have shortness of breath very easily. So if sometimes we need to take a breath or a break and we have a couch by us or a bed or something we can lay down, a nice way of breathing as well is called belly breath. And so what you would do is you would place your left hand on your heart and your right hand on your belly. So when you inhale, you want to inhale and fill your belly filling up. So it should be expanding as you inhale. And then when you exhale, your belly starts to go in, naturally flatten out towards the spine. And the reason you have your hand on your chest is so that your chest shouldn't be rising when you breathe through your belly. So when you breathe in, and then exhale through your belly. Breathe in through your nose. The belly expands, and you should be able to feel that on your right hand. And as you exhale, push the breath out through your lips and feel the belly deflate. Again, inhale through your breath, in through your nose, fill the belly up, and then exhale through your lips, slightly blowing that breath out, letting the belly deflate. Again, inhale through your nose for a count of 2, hold, and then exhale, push the air out through your lips, and let the belly deflate. Doing great. So let's inhale through your nose, fill up the belly, hold at the top, and then exhale, let the belly go, let it deflate. Doing great. Inhale one more time through the belly. Fill the belly up. Hold at the top. And then exhale through your mouth. Push the breath out, and then feel the belly go back towards the spine. Beautiful. You guys did wonderful. So I do also want to end today's talk about mindfulness throughout our time. So right now what we did, we just became very aware of our breath. And mindfulness is becoming aware of our present moment. And as we are starting to come into this certain whatever wave we are in the pandemic of the COVID, I believe we're into our second or third wave, but we want to always go back to our basics, and that's washing of the hands. Washing of the hands is probably one of the most mindful techniques that we can practice during COVID-19. So when we want to wash our hands, we want to let the water first run through our hands and feel the temperature of the water. Is it a hot or is it cold? Is it how is it feeling with you today? Is it a hard water? Is it soft water? Just be mindful and see how the actual temperature and what the water is feeling like that day. And then how are you going for the soap? Are you just grabbing for the soap of bar, or are you pumping the soap out of a soap dispenser? How is the soap? If it's a bar, is it hard? Or if it's the soap and liquid, is it a viscous gel? Is it watery? Just pay attention to the type of actual hand soap that you're using. And then as you begin to wash your hands, start to maybe see if the hand soap has a fragrance. Are you smelling the smell of clean linen or lavender and basil? And so this is the way that we can practice mindfulness during our hand washing techniques. And then as we continue to just wash our hands, just scrubbing underneath each individual fingernail, making sure that we're cleaning each hand and each finger individually, scrubbing the fronts of our palms and the back of our hands. And as we rinse, again, just being aware of the temperature of the water, of how it feels. How are we turning off that faucet in a public place? Are we grabbing for a tissue to turn that faucet off with our clean hands? So these are ways that we can practice mindfulness, but a great way is always to just step up to wherever we're going, take a nice deep cleansing breath so that we become aware of where we're at and how we're feeling at the moment, and then start our task for the day. So thank you for allowing me to talk to you guys today about some breathing techniques.
Thank you so much, Analisa. That was a really very nice exercise. I know that many of us have probably been feeling very anxious this week with the elections and with COVID, and I think it really means a lot to a lot of people, I think, to bring it down to just our breath work again and reminding ourselves of that, that our breath is sacred.
Yes, it's the breath is it's one thing that's very nice is that we always have our breath with us, no matter where we're at. So sometimes we're not having a lot of things accessible to us, but the one thing that is always accessible is our breath.
I'm going to ask maybe our attendees if there's any questions that anybody has, or maybe thoughts that they had while going through the exercises that they would like to share with everybody. I know we had a lot of people come through, Analisa, that said that the exercise felt good. They definitely felt less anxious. A lot of smiley faces are coming in right now.
That's wonderful. I do encourage people just to start small, to maybe just a quick 3 minutes or 5 minutes, just to feel the benefits of any type of breathing technique. And the same goes for maybe just a quick walk around the block. We don't need to run a marathon. We can always just start with one block. And again, with yoga, there's so many different types of yoga available. Accessible yoga for our elderly or for injured patients would be Iyengar yoga. Iyengar was actually made for one of the founders of yoga. He had injured himself and wanted to continue to practice and started to use modifications for his yoga practice. So it's really nice to be able to incorporate all the different ways of exercise as well as with yoga.
I also noticed that you're wearing white today. Are you raising education, or are you wearing this in honor of somebody?
Well, my grandfather passed away when I was 12 years old of lung cancer. So I have always been aware of just being aware of my own health and my own lung health, as well as my oral mouth health. That also goes in conjunction with it. So I've always, that's why I kind of brought up the plugins. I was unaware of the Bed Bath & Beyond, the wallflowers releasing the carcinogens in the air, and that was a big alarming to me. So I started to looking into more aerosols and air fresheners and how dangerous they were, and then just always wanting to be aware of my lung health and Sage's lung health as well.
I don't see any more questions coming in right now. Is there maybe some last words that you would like to leave us with for today?
I just really appreciate everybody taking the time to take a couple of breaths. And like I said, you always have your breath with you, and just remember at any moment in time that you need to just relax, just maybe take a nice deep cleansing breath through your nose and then sigh it out and let it go.
Well, thank you so much. I know I got a lot out of this, so thank you for sharing your knowledge and your wisdom with us all.
Thank you again for this opportunity. Appreciate it.
All right. Well, everybody, like I was saying earlier, this has been recorded and we will be sharing it soon on our YouTube channel. So stay tuned for that. And please do keep reminding yourself today to just remind that your breath is with you wherever you go, and have a great rest of your week. All right. Bye.